Welcome to another episode of Ino Health Podcast. Today, we have Dr. Sanjay Sharma. Dr. Sharma is a leading podiatric surgeon in Bangalore, specializing in diabetic foot condition with 23 plus years in healthcare and expertise in telemedicine, chronic disease management, and wearable devices. He pioneers tech-enabled patient education in education and wearable devices. He holds a master's in surgery, a PhD in Ayurveda, and podiatry training from the University of Arizona. As executive director of APTA Healthcare Advisor and founder of Yostra Labs, he recognized with the Technology Pioneer Award by the World Economic Forum. Join us as we explore Dr. Sharma's journey from his academic pursuit to his innovative approaches. Welcome, sir. So, how are you, sir?
All well. How about you?
I am too. How was your day, sir?
All good, yeah. All good.
Okay. So I read, I went to that your website of Yostra Labs. So I read there about digitally enabled podiatry system ecosystem under your bio. So can you tell me about that? What does that mean?
So, first of all, we will have to know what conditions we are looking at from the podiatry. Podiatry means
Mm.
anything below the knee or foot and ankle conditions.
Yes.
And today in India, the major issue that we are dealing with as a podiatric surgeon is diabetic foot. And
Mm.
there is very less awareness on the incidence and the enormity of diabetic foot conditions in India and most of the other South Asian regions also, including the West, I would say. Every 20 seconds, there is a limb that is amputated due to diabetes. And these amputations can be prevented if we have intervened early on. So the device, medical device that has been invented at Yostra Labs was a device called NeuroTouch, which is a multi-parameter diabetic peripheral neuropathy device where we can diagnose the diabetic peripheral neuropathy very early on, so that diabetic foot ulcers can be prevented and in turn amputations can be prevented. So that's on the Yostra lab that you mentioned about, which I'm one of the co-founders and been supporting them in inventing this device. That Yostra
Okay.
Labs is a diagnostic device which is used by the
Mm-hmm.
doctors
Mm-hmm.
and in their clinics to diagnose diabetic peripheral neuropathy.
Okay.
Okay, it is not to the given to the patient or anything. It is to more to
Okay.
diagnose in the clinics by the clinicians. It could be nurses, it could be doctors or
Mm-hmm.
anyone. So they use it to diagnose the diabetic peripheral neuropathy, and it is meant for diagnosing diabetic peripheral neuropathy. As I said, every
Okay.
20 seconds a limb is
Mm-hmm.
lost due to diabetes, and it is the mortality rate is higher than cancer. So let us
Mm-hmm.
not deviate from the pandemic in hand, that is diabetic foot.
Yeah. So, like when you know introduce this no NeuroTouch and the device, the diagnostic device, what kind of challenges did you face?
Challenges was in terms of acceptance only, so people, the doctors especially, were reluctant uh, to check the foot.
Mm,
When somebody is a diabetic, none of the diabetologists will ask them to open their footwear and then say that, okay, let me check the foot. They would check
mm,
their blood sugar readings and the HbA1c and then write a prescription of what needs to be done. But
mm,
the thought of, forget the new device or anything, but the thought of examining a foot itself was not there. So we had to convince them of how important it is to get check the feet on a regular basis, and then to use the device to do that, and also create an awareness amongst the patients to ensure that whenever they get checked for their diabetes, their foot also needs to be checked.
Okay, so like after the introduction of this diagnostic device, what changes or did you see any changes in numbers of reduction in diabetic foot or
Not
amputations?
so, not so fast here in the sense,
Yeah.
as I said, there are 100 million diabetics in India,
Yeah.
and 50% of them, in the sense 50 million, have a diabetic peripheral neuropathy.
Hmm.
So, and there is no registry that we
Hmm.
see in India per se. There is no diabetes registry only. Forget about diabetic foot registry. So, we
Hmm.
really cannot pinpoint saying that this device has been used by so many people and amputations have reduced anything. But significantly, there is an acceptance amongst the doctors, with the government, with the private doctors and everyone, where more
Hmm.
and more awareness is being created about checking the foot and the diabetic peripheral neuropathy. This has been used to um, you know uh, diagnose early on the peripheral
Hmm.
neuropathy
Hmm.
and start the medication. But we really cannot say how much percentage of amputations has been prevented because we don't have a baseline data itself.
Okay. So apart from this device, is there any new development or research in the podiatric surgery that you would like to share?
There are quite a few. This is one of the device that has been there. We have
Hmm.
been involved in a self-offloading footwear, which is absolutely necessary in today's world, where in diabetic peripheral neuropathy, we everybody prescribes, most of the doctors prescribes customized footwear or a offloading footwear, which is today globally there has been only static offloading footwears and not dynamically offloading footwears. So there is an invention of a dynamically self offloading footwear that we are doing the trials on. So that's something that you could see it in the market
Hmm.
in a year or so. There has been another device called Velox, which is a warm oxygen therapy for chronic ulcers. That will be in the market in a day in this week per se. So that is for a home care device where a warm oxygen is provided to a topical ulcer, chronic ulcer, which will enhances its rate of healing. Um, and quite a few minimally invasive surgical techniques that we have been using at FootSecure. FootSecure is a hospital for foot and ankle conditions, and
Yes.
especially diabetic foot conditions and sports injuries and other things. So various minimally invasive surgeries we have been doing, where the recovery time is significantly lessened, where people can walk back in 2 days or 3 days, wherein earlier they have to be in the cast for at least 3 to 4 weeks. um, there have been regenerative medicine where we 3D print the adipose tissue extracted from the patient himself and then put it on a chronic ulcer where it heals much faster, say in 5 weeks in comparison to 12 to 20 weeks without this kind of a treatment. So there has been various innovations that I have been involved in, from regenerative medicine to minimal access surgery to biomechanical devices, which is an ongoing process.
Okay. So, like the footwear plays, there are variety of footwears in the market, like the common, not for the diabetic, but there are a variety of like saying this will help your, your gait, your hair, it will help your posture, like that. So, what does is it like a marketing gimmick, or does any this sole, like ergonomic sole, have any role in posture, gait, or anything?
So these are all these are all footwears that are meant for a normal foot for various activities. If there is some kind of a pathology in the feet, it could be a flat foot or a low arch feet, or there is a pain in the heel or things like that. Then a customized footwear is what we would recommend rather than off the shelf. The advertisements that we see of this is meant for plantar fascia, the fasciitis, or this is meant for Achilles tendonitis is more of a what I would say, the word you use, the marketing gimmick. But if it is a
Yeah.
normal feet for and you can use all these shoes, like you get a running shoes or a basketball shoes or tennis shoes kind of a thing. They are all meant for that sport for a normal feet.
Okay. So you mentioned about sport injuries. So what kind of the role a podiatric surgeon or a have in sports injuries or
Any
like
injury
related?
of the ankle. So we
Hmm.
have seen that most of the active sporting athletes have 40% of their injuries are in the foot and ankle, especially the
Hmm.
ankle sprains and other things. So podiatric surgeons take care of any condition of the foot and ankle. So it could be a sports injury of the ankle or the foot or the toes is taken care by a podiatric surgeon, or it could be arthritis of the foot and ankle is taken care by us, or it could be a trauma or an accident that happens to the foot and ankle is taken care by us, and of course diabetic foot.
So what are the common foot problems that come to you, come across to you, and how we can like the people can prevent them?
Prevention is
Common foot.
depends. Prevention is depends on the what are the foot problem. We have
Yeah.
about 300 plus ailments that affect the foot.
Hmm.
So it is not foot is not a single thing. We
Yeah.
have about one fourth of the bones in the body is in the foot, and there are 119 tendons and ligaments that we see there.
Yeah.
So it is a complex organ, and we tend to ignore it completely, say, and take it for granted. So
Hmm.
uh, in out of those 300 plus, we can categorize them to uh, in what do you say, in three buckets. One would be uh, the common ailments, in the sense it could be plantar fasciitis or Achilles tendonitis, ingrowing toenails, in the sense pain in the heel, pain in the balls of the feet. Those are the things that we can categorize in as a very commonly occurred ailments that we see. The second is all the sports injuries, or where they're exerting more than usual activity on the feet, and the feet gets injured. And the third one is major issues. It could be diabetic foot conditions, or it could be clawfoot, uh, which happens in the kids. Or So these are the buckets that we can categorize them into. And in my practice, I would say the sports injuries, running injuries, where there has been ankle sprains, twisted foot, and other things. There could be heel pain. There could be pain in the forefoot, and diabetic foot. So these are the most common uh, ailments of the foot that we see regularly in our practice.
Okay. So I read like you have a PhD in Ayurveda. So how do you blend traditional medicinal practice with modern healthcare in your work?
PhD was more of some interest on a specific topic,
Okay.
where we were looking at when I was doing my post graduation, we were looking at carpal tunnel syndrome. That
Hmm.
is a syndrome that affects computer users in the hand. This was
Hmm.
quite some time back. And I saw that Ayurveda had some interventions which where the principles of Ayurveda can be used for this specific ailment called carpal tunnel syndrome, and my PhD was on that. But today, wound care has been challenging. It could be for the
Yes.
allopathic medicines, or it could be for the traditional medicines also. We have seen non-healing wounds going from anywhere between 12 weeks to 52 weeks, and this leads to major infections and mortality also. So we've been open to using all the traditional methods of wound care, wound healing, and with a modern texture to it. For example, honey has been recommended for wound care in Ayurveda also, and we have been using it regularly in our routine practice also. So these are the various blends that we can put forth together in ensuring that the wounds are healed much faster.
So you mentioned about carpal tunnel syndrome. I think I also have that pain in my right hand. So how can, like, one can take care of their hand, because we can't stop using our mouths and our keypads. So any.
Exercises, routine exercises. So this has been, you have been asking questions of carpal tunnel syndrome, which I had done it some 10 years ago, 10, 12 years ago, or even more than that. So
Okay.
after that, I finished my podiatric surgery and I've been focusing majorly on the foot. But regular exercises and keeping the tendons and the ligaments of the hand strengthened is something that can prevent carpal tunnel syndrome, if not curing. Curing could be a carpal tunnel release surgery. That is,
Mhm.
like in the worst case scenarios, that is what is being done.
Okay. So, as are there any lifestyle, changes that will affect, affect the foot, or it will lead to surgery or anything, like that? Like, osteoarthritis. You have mentioned about arthritis. Like, how can one? That's the major problem. Like, most of the, like, I come across the people of the older generation have this, arthritis issue. So how can that be, it can be cured, but how can it be managed?
No, arthritis is a degenerative condition of the bones,
Hmm.
and
Yeah.
there are various regenerative medicines, injections that are available, which, when treated early, the OA uh, can be postponed. That's one part of it. Secondly, if you're looking at the foot perspective, most of the different ailments catalyzes with the wrong footwear. So you will have to
Hmm.
use the right appropriate footwear. I would say, I wouldn't say right. It is not. We cannot generalize that flat foot is right for everyone or heels is bad for everyone. Those kind of things is not something that we can generalize. It depends on the individual feet. So similarly to, as you use your glasses, if somebody's eyes are perfect, they don't use the glasses. But if there is some myopia or hypermetropia that we see in the eyes, then they start using glasses, and it changes from person to person. The power is not the same for everyone, or every eye. So similarly, foot is something that is different for each person. And if you have a problem, then it is better to consult a podiatrist and get a right footwear rather than going with the fancy and casual footwears.
So, like, if a person wears some wrong footwear, it will affect not only the foot as well as its spine as well.
Knee, low back, spine,
Like,
neck, everything.
hmm, yeah. So, can you share a story about a patient whose foot surgery had a big impact on their life? Like, some kind of story I would like to hear. Like,
Most of them, yeah, in the sense, when we
yeah.
are talking about diabetic foot, we have been known for preventing amputations. So the India
Hmm.
average of amputations is about 19%, and at Foot Secure, we are at about 2.63%. So each person where they have suggested an amputation in a different healthcare setting, when they come to us, we are trained in looking at every tissue being important. We don't say that, okay, this is a last toe here and a fifth toe here, which is not important. Let's amputate it, or this is only a finger or a toe. Let's amputate it. We are looking at how can we save each and every tissue and each and every bone. So most patients who come to us, say for example, there was a patient in a remote town. called Shivamogga in Karnataka. It's a district headquarters that you would see, and he went to a local hospital there with a blister in his foot, and it was treated, but um, that never healed. It reoccurred again. It reoccurred. It became uh, a non-healing ulcer, and he had to go to a larger hospital close by, in a close by city, which was a medical college and a hospital. He was admitted there for almost about 2 months, and two of his toes were amputated, and finally he was to ask that his complete lower limb below knee amputation had to be done, and that is when somebody told them about foot secure, and he had come to us, and where we were able to recognize the condition, do appropriate care. This is not a miracle. It is just that we need all the treatments. What needs to be done is there in the public domain, but it is just that our doctors who have been trained in surgery and other things are not trained in podiatry. So we had to look at his biomechanics of how he's walking, how he's standing, and what would help him, and addressing the biomechanics and appropriate wound care is today he's able to walk on both of his feet, and he's been walking on both of his feet for almost about 2 years now. And these kind of patients walking on on both of their feet and not getting into a wheelchair bound for the rest of their lives will inspire us to do more and more.
Absolutely. One can't imagine to his or her life without legs, because although we ignored our legs or our feet so much, but that's the one helping us to stand up.
Yeah.
What last? This is the we are in the last segment of our podcast. So, what advice do you have for someone interested in becoming a podiatric surgeon and then a young generation?
Podiatric surgery is not there in India, so
Yeah.
uh,
I,
um,
maybe you can come up with a course for
yes,
them.
but it's not there in India today. Sad to
Mm.
say, which is a need of the hour. But
Mm.
today, if you are to be a podiatric surgeon, there are various opportunities outside of India. It could be Europe, UK, US, Australia, or South Africa. These are the best places to go and pursue your podiatry career. Even just after your MBBS, you can go abroad and do a DPM, Doctor in Podiatric Medicine, or after your MS, you can go and do fellowships which is offered by various colleges. Lately, we have seen fellowships being offered in diabetic foot care in India by a couple of hospitals in Kerala, in Tamil Nadu, and in Delhi. If you are interested in diabetic, if somebody is interested in diabetic foot care, then they can look at these institutes in India also.
So, what's your message for our listener? Like, how can they take care of their feet
Just
and
ensure
put
that
the
they treat their feet as their face. Moisturize your feet. Look at your feet every day. Don't ignore them just because you can't see them. As you see your face every day in the mirror, look at your feet every day, and if there is anything abnormal that you see, please visit a podiatrist rather than ignoring it.
yeah. And diabetes patient, please look after your blood sugar level. Yeah.
Yes.
Thank you so much, sir,